Providing for the well-being of the vulnerable should be a given. This is not always the case, and in 2018 a Royal Commission into Aged Care Quality and Safety was announced after some serious abuse of vulnerable people by those working in the sector was identified. The Royal Commission investigated the quality and safety of residential and in-home aged care for older people and young people with disabilities. The final report, entitled Care, Dignity and Respect, was published in March 2021. The government has already promised $452 million to improve the sector, and more funding is expected to be announced in May. Vital Home Health Services fully supports the recommendations laid out in the Royal Commission, which will help continue to rebuild a strong aged care system in Australia. After reviewing over 400 submissions, some of which were described as disturbing, the Royal Commission found that the Australian aged care system fails to meet the needs of its older vulnerable citizens. It does not deliver uniformly safe and quality care. The Commission determined that the system requires fundamental reform. Whilst these findings were concerning and widespread, it's important to note that there are also many hard-working and dedicated people within the aged care system, but it is the system itself that is being reviewed. There were 148 recommendations published, looking into key areas such as the Aged Care Act, funding, governance, which is administration, and quality and safety. Some important recommendations include replacing the Aged Care Act 1997 with a brand new rights-based act that centres the desires and needs of those requiring care rather than one driven by budgets. Increasing funding through a possible levy to taxpayers. An overhaul of how aged care should be governed to ensure standards are maintained. Ensuring staff are correctly trained to work in the sector. A star rating system for care providers. Requirements mandating minimum staff time for registered nurses. As a high-quality accredited care and nursing provider, there are no immediate actions that need to be undertaken by Vital Home Health Services. We do expect to be updated on any significant changes emerging from the recommendations. Any recommendations and protocols that need to be put in place will be acted upon accordingly and promptly. Our team, led by a Director of Nursing with over 28 years of experience, are committed to maintaining our excellent standards of care and services, and are continuously monitoring guidance to ensure required changes are implemented smoothly. In the meantime, you can be certain that we will continue to provide the same high-quality service as always. We will continue to update our clients and carers via our website. We are as dedicated to providing best practice home-based care as ever. In fact, our approach to care standards and staffing are already in line with many of the recommendations. We strongly support the need for a rights-based Aged Care Act. This is something that already aligns with our organisation's philosophy. We take a person-centred approach to care, meaning that our services are personalised, tailored, and take a client's preferences into account. A view of standards and a star rating system is also welcome. Vital Home Health Services are already accredited with the Australian Council on Healthcare Standards, ensuring that the nursing and support staff entering your home are of the highest standard. We also hold extra accreditations that are in addition to the mandatory, meaning not many other home care providers go the extra mile to obtain them. That is how committed we are to providing the best care and support services to our clients. We employ and provide educational support to our registered nurses. We also employ clinical support specialists, which include a team of senior registered nurses, nurse educators, and a wound nurse practitioner. Should any changes to processes or standards arise, you can be certain that Vital Home Health Services will implement them promptly. At Vital Home Health Services, you can be confident that your loved ones will be cared for with compassion and dignity within the comfort and safety of their own home. We are proud to have been delivering high standards of quality care for many years and will continue to maintain these excellent standards throughout the rollout of the aged care reform. These are changes to our industry that we gladly welcome.